Hello, everyone. Today we're going to talk about hepatitis C. What is hepatitis C? Hepatitis just means inflammation of the liver, and C just refers to the specific type of virus that causes it. The hepatitis C virus, also known as HCV. So, in plain language, hepatitis C is a germ that gets into your bloodstream and attacks your liver. Think of your liver like a cleaning system. It removes waste, it cleanses your blood, stores vitamins, and helps digest food. But when the hepatitis C virus enters, it irritates the liver. Just like dirt clogging up a filter, the liver becomes swollen, sore, and tired, and it cannot clean your blood as well as it did before. Over time, that irritation turns into inflammation, which simply means your body is reacting to something harmful and trying to fix it. If the infection stays for too long, the liver can start forming scar tissue, kind of like a wound that doesn't heal properly. This scarring makes it harder for the liver to do its job. And if not treated, it can lead to liver damage, cirrhosis, or even liver cancer. Here's the tricky part. Most people with hepatitis C don't even feel sick at first. There's often no pain, no fever, and no obvious signs. That's why it's called a silent infection. It can live quietly in your body for 10, 20, and up to 30 years without you even knowing, while slowly damaging your liver. That's why awareness and early testing is so important. The good news about hepatitis C is it can now be completely cured. Modern medicine has developed simple pill treatments that remove the virus from your body in as little as 8 to 12 weeks with some side effects. So knowing what hepatitis C doesn't bring fear anymore, it should bring you power. Because once you know what you're fighting, you can win. Psalms 119 and 66 says, "Teach me good judgment and knowledge, for I believe your commandments." When we seek knowledge about our health and we're not walking in fear, we become where we're walking in faith and wisdom. Now that we understand what hepatitis C is, let's talk about how it spreads. The hepatitis C virus lives in the blood of someone who's infected. That means you can only get it if someone's infected blood gets into your bloodstream. This is what healthcare providers call blood to blood contact. And it spreads through sharing needles or syringes, unsterile tattoo or piercing equipment, blood transfusions, or organ transplants before the year of 1992. Before blood screening was improved in the early 1990s, some people contracted hepatitis C through donating blood. If you had a transfusion or major surgery before 1992, it's wise to get tested just to be safe. Sharing personal hygiene items like razors, even your toothbrushes or nail clippers can carry tiny traces of blood. You might not see it, but the virus doesn't need much blood to spread. Now, the virus does not spread through hugging or shaking hands, sharing food, drinks, or utensils, sneezing or coughing, kissing, or being around someone who has it. The virus cannot live outside the body for long, and it's not spread through saliva or casual touch. So you can love, hug, and care for someone with hepatitis C without fear. Just be cautious with blood exposure. Now, some of the common symptoms of hepatitis C is feeling tired or weak. The liver helps turn food into energy. So when it's inflamed, your energy drops. Next, loss of appetite and or nausea. Stomach pain, especially on your right side, right abdominal pain. Dark urine or pale stool. These are signs that the liver isn't processing properly. yellowing of your skin or your eyes. This is called jaundice. This happens when a substance called bilirubin builds up because the liver cannot clear it out anymore. Itchy skin. When toxins build up, the skin sometimes react by becoming itchy. Also, low-grade fever or mild flu-like symptoms. In the past, hepatitis C treatment was hard. Long injections, strong side effects, and uncertain results. But everything changed when a new class of medications called DAAs, direct-acting antivirals, were created. These are simple pills, no injections, and no hospitals. You take them once a day for 8 to 12 weeks, and they're more than 95% effective in curing the hepatitis C virus. That means almost everyone who completes treatment, again, I say completes treatment, becomes completely virus-free. Now, let's look at what treatment looks like week by week. Weeks 1 and 2, most people notice very few side effects. Some feel a little tired, but many feel better quickly as the virus starts to clear. Weeks 3 to 6, liver enzymes begin to normalize, energy improves, and appetite returns. Weeks 8 through 12, the virus becomes undetectable in nearly everyone who stays consistent with treatment. And after treatment, your doctor will recheck your blood 12 weeks later. And if no virus is found, then you're considered cured. Even after cure, regular liver checkups remain important, especially if there was present liver damage. Now, even after treatment, there are lifestyle recommendations that are highly recommended, such as avoiding alcohol completely. It slows liver healing and can cause additional damage. Drink plenty of water. Eat balanced, liver-friendly diets, more fruits and vegetables, and lean protein. Get enough rest. Your body is doing serious recovery work. And limit unnecessary medications or supplements unless your doctor approves of them. Hepatitis C used to be a frightening long-term diagnosis, but today with modern medicines, it's one of the fewer chronic viral infections that we can really cure. More than 95% of people who complete treatment becomes virus-free. If you or someone you know has risk factors, a history of injection drug use, tattoos, or blood exposure, get tested. If positive, treatment now gives you a powerful chance not to just live, but to thrive. So today I declare complete healing over you, physically, emotionally, and spiritually. May your liver be restored, your faith strengthened, and your wisdom increased. And may you never forget that knowledge is not fear, it's wisdom. I love to hear from you. What did you learn today that inspired you the most? Drop your comments below, and let's keep learning, growing, and living in wholeness together. Until next time, stay informed, stay faithful, and stay well.